Kiss 92. It's Kiss 92 and it's time for Doctors in the House. And this month we're learning how to deal with emergencies.
Yes.
Like for instance, when should you visit the A&E when seeking medical attention?
Yes.
Here to tell us more is Dr. Vivian Chan, Senior Resident Physician from the A&E Department at Mount Elizabeth Hospital. Welcome.
Hi, Jason, Maddie.
Yes, thank you so much for coming. We would like to know, Doctor, what are some of the most common conditions you come across in Mount Elizabeth's A&E?
The A&E department is, we accept all cases, anything and everything that comes through the door. So we do see cases that range from life-threatening cases like heart attacks, strokes, asthma, to minor traumas like broken bones, cuts and lacerations, to the more mundane cases, like even asking for a prescription of a hypertensive drug.
You ever get like people who do stupid things, like put something in their ear, put something in their nose? You get a lot of that stuff, right?
We do. We get lots of children who are very curious and they put things in their ears, they swallow things.
And we always hear things about cockroaches and lizards going to your ears. I mean, does that really happen?
Absolutely.
Really?
You just ruined everybody's day.
Well, often the patients are sleeping when the cockroaches actually...
That's horrible.
Look at Irene. She's actually covering her ears.
But you have to deal with all this crazy stuff every day.
We do, and that's the beauty of working at the A&E.
Something new all the time.
Absolutely. Something new all the time.
So what happens when, say, for example, somebody comes in, I suppose with kids, even with...
A broken arm or something like that?
or fractured bone. What's the first thing? How do they get treated?
So they come through to us and we triage them if they're in a lot of pain or the triage nurse perceive them to be a little bit more serious than the other cases. So they get seen earlier.
Right.
And then after that, they get their vital signs taken to make sure that they're all fairly stable. And then they come and get ushered to us, or we go and see them depending on how sick they are.
Is there any way at all to be better prepared for emergencies? I mean, especially when you don't even know what kind of emergency would crop out or could crop up in your life.
Yeah, I think if you have pre-existing illnesses, if you have diabetes or if you know you're a cardiac patient, you should take ownership of your illness. So know a little bit more about the alarming symptoms, all complications that can occur, and then speak to your doctor about what can be done at home before you even start calling the ambulance. For
You're
example,
a responsible patient.
Yeah, so if you have a heart patient and you have chest pains, it could be a heart attack.
Right.
So take your aspirin, and then there's tablets you can put under your tongue to try and dilate your coronary vessels. If you can do all that and then get onto the phone and either call the emergency numbers, have them next to your phone.
So interesting.
So you have to be a good patient, a responsible patient.
Absolutely.
So you can't just leave it all up to the doctors.
Absolutely.
Yeah.
Taking care of your own health, right?
That's
Taking ownership. I really like that, of your condition. That was very helpful. To find out more about Mount Elizabeth Hospital's A&E, you can log on to mountelizabeth.com.sg, or you can also call the 24-hour A&E helpline at 6731-2218 for Orchard, or 6933-0100 for Novena. Thank you so much, Doctor.
Thank you very much.
Thank you.
Kiss 92.
Thanks to Harvey Norman's and